Have you thought about adding a specialty certification to your training and wondered if health coaching was a good option? Well, in this video, I'm going to share how getting a health coach certification has impacted my career and help you decide if it's the right move for you. Hey folks, I'm Amy Hager. I'm a registered dietitian in private practice. I'm also a certified health coach. Welcome to my channel where I share tips about being a self-employed dietitian, and feel free to subscribe if you want to be alerted to my newest videos. So health coaching seems to be more popular than ever now, but I want to share with you today why I think it's an excellent choice for dietitians in particular. It was about 15 years ago when I first noticed the term health coach. It was in relation to an insurance card that said you could call and talk to a health coach anytime. It was a hotline. But back then, I think that these health coaches were primarily trained nurses who helped answer medical questions and provide guidance to help reduce healthcare costs for insurance companies. But in those 15 years, several health coaching institutions have come about to provide a variety of certification opportunities. There's the International Coaching Federation, WellCoaches, Ace Fitness. Now, those are just a few of the popular choices that are out there. And I was just really super curious about this. And I was working at the hospital at the time, and I started looking into it, looking online to see what kind of job opportunities there were. Amazingly, I actually found a job listing looking specifically for a dietitian health coach. And even more amazingly, when I applied for this job, I got the job. The crazy part was that I didn't even have health coach certification yet. The company that hired me was really most interested in my status as a dietitian, and they were willing to get me the training to become certified as a health coach, and I was super excited about this. Their preferred program to put their employees through was called WellCoaches, which is really prominent today. After 16 weeks, I passed my exam and was certified as a health coach. And I enjoyed the program so much, I asked my employer if they might be able to put me through the advanced program, which was like a 6 or 9 month program. So it was like the highest level that WellCoaches offered at the time. So I got my professional health and well-being certification after that, and I just hung it up here. So how did becoming a health coach enhance my work as a dietitian? Well, first, I really learned applicable counseling skills that I use on a daily basis to help clients set goals and achieve them. There's a lot of motivational interviewing that went along with the course and the training, a lot of techniques to help clients. I think the biggest difference is the relationship that I saw with my client. Instead of being an expert teacher, I was more of a partner in their wellness journey. So I think actually is more collaborative, and it leads to greater efficacy overall. And the advanced coach training program that I did, we focused a lot more on psychology, emotional intelligence, and motivational interviewing, motivational techniques to really get a deep understanding of what drives a client's decisions and motivations and actions. And I really feel like we don't get this kind of training as a part of our college degree as dietitians. The second reason I feel like becoming a health coach is an asset as a dietitian is that it opened up a lot more doors professionally. A lot of employment opportunities came about by my focus on wellness and health behavior change, especially in the field of remote or virtual work. So if that's on your bucket list, definitely consider health coaching as an avenue to get there. So right now, I just looked 5 minutes ago online. You can work for a variety of companies in the virtual capacity. Think Noom, Weight Watchers, Omada, even insurance companies like Aetna. They are advertising for virtual remote positions for health coaches. Dietitians even have more of an advantage over the average Joe who gets a health coaching certification because our medical training and experience. And many of the virtual coaching positions are limited to dietitians and nurses. They want you to have this background, a master's degree or healthcare experience. And so these positions pay better than just a general health coach. So I worked for a company called Vita Health, and they had their own client app and experience, and that gave them, the client, the access to a dietitian. And due to the regulations of practicing medical nutrition therapy across state lines, because it was a virtual position and I had clients in all kinds of states, I primarily worked in the capacity of a health coach, giving general health and nutrition advice, never a prescribed diet to treat a particular disease state, because that's the definition of MNT. But I would work with clients week after week on their goals, on their progress, checking in with them, very, very similar to the role of a dietitian. But I love the flexibility of being able to work from home, being self-employed. I was a 1099 contract employee, so I was still in control of my hours, setting my own schedule. And the great news is that jobs like this are becoming more and more available. And you, as a dietitian, are the perfect match for positions like this. Now, I'm not saying that every dietitian in practice is a good match for becoming a health coach. You obviously have to have an interest in counseling clients, but if you're wanting to transition, say, out of an area of dietetics that's not really counseling based, like maybe it's more clinical or maybe it's more community based, and you want to get into more counseling, getting certified as a health coach would be an ideal way to get this experience. There are some drawbacks, obviously cost is a drawback for a lot of people why they don't pursue this. And I would say with just reviewing WellCoaches program right now, their health coding certification is over $2,000. And if you're looking into WellCoaches specifically, but this might be an expense that you negotiate with your employer, or it's a business expense for you if you are currently self-employed. There's one more facet to health coaching that you should be aware of, and that is the National Board for Certification opportunity. Now, this is something that's relatively new. This wasn't available when I did health coaching 15 years ago when I got certified. So not every health or nutrition coaching program sets you up to be eligible for sitting for the National Board exams. So that would be something to look into. I do not have a board certification because it is relatively new. And the advantages of getting board certified would be to demonstrate that upper level of expertise, increasing your chances of getting any remote job that requires a health coach certification. The other thing interesting about board certification is that now many health insurance companies are recognizing health coaching as a reimbursable expense, meaning that there's a unique billable procedure code now in use, which is a huge advancement for the field of health coaching, adding to its validity. And I see this only expanding as the field grows. But aside from the expense, it's hard to argue that obtaining a health coach certification is not a benefit to your practice as a dietitian who counsels clients on behavior change. I think it's really filled in a huge gap in our training. I don't feel like we really get enough experience learning counseling for clients in school or even in the internship. And additionally, I feel like it opens up a broader discussion with our clients to discuss more aspects of wellness like exercise, sleep habits, and stress management. So after all, we do want to be holistic in our approach to help our clients become more skilled and mastered in changes to their well-being and improvements. But getting that training as a health coach, I feel like was a huge change in the way that I work with clients. It's definitely given me a lot more confidence in how to speak to clients, how to set up our sessions, how to focus on goals and step-by-step actions and how to achieve them, and how to recognize signs in your clients to bring in more motivational interviewing techniques and maybe where to spend more time with them before overloading with too much information. There's definitely a lot of great things that I got from my WellCoaches training. I'll leave a link to the WellCoaches below if you want to look more into that program. I hope this video was really helpful in describing the advantages in becoming a certified health coach, especially if you're a dietitian looking to up your counseling game. And if you'd like to learn more about becoming a self-employed dietitian or starting a private practice, feel free to set up a discovery call with me. I'll leave that link below in the video description as well. So here's to becoming an even better resource for your clients and creating greater satisfaction in your work. We'll see you next time. Bye-bye.
Thanks for watching, guys. Be sure to catch the latest video here. And don't forget to subscribe if you'd like to see more videos on private practice and being self-employed as a dietitian.